Good evening, Mr. Lombardo. My name is Molly. I'm a nurse practitioner student. I'm going to be conducting a physical exam on you this evening. I just want to ensure your privacy and comfort, so if any point throughout this exam that you're uncomfortable, please let me know. Could you please tell me your most recent height and weight?
5'11", 190.
Good. I'll be using that to calculate your BMI. I'm just going to use some hand sanitizer here. Can you tell me your full name?
Chad Lombardo.
And where are we right now?
Your office?
What is today's date?
April 10th.
What is your fiance's birthday?
February 28th.
What was today's appointment time?
4 o'clock.
Can you spell world backwards?
DLROW.
And what do people mean when they say don't cry over spilled milk?
Don't worry about small mistakes.
Good. Okay, next I'm going to test your cerebellar function. On your thighs, I want you to pat back and forth as fast as you can. Good. And with your finger, I want you to touch your nose to my finger. Back and forth. Back and forth. Good. And the other side. Good. Rest your hands on your lap. I'm looking for tremors. Flex them out. Same thing, tremors. Good. Now close your eyes. I'm going to be moving one finger either in the up or down direction. I'm going to ask you, and you tell me which direction is moving.
Up. Up. Down.
Good. And same thing on your toes. Keep your eyes closed.
Up. Down. Up.
Good. Next, I'm going to be testing some of your senses. This is going to be light touch sense. This is a cotton ball. I'm going to have you close your eyes, and you're going to tell me when I'm touching you with the cotton ball. Okay?
Now. 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 Now.
Good. Pain sense. This is going to be what's called, you can say sharp. That's what sharp feels like.
Mm-hmm.
This is dull. I'm going to be touching extremities with either sharp or dull, and you tell me which one with your eyes closed.
Sharp. 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 Dull. Dull. Sharp. Dull. Dull.
Good. If you could also close your eyes, I'm going to give you an object. I want you to see if you can identify it.
A coin?
Good. I'm also going to be testing your sense of vibration. I'm going to make this vibrate, and you tell me when it stops, and I'm going to move it up, and you see if it's still vibrating at that time. So give me one finger.
Stop. Yeah, still going.
And on your toes.
Stop. Yeah, it's still going.
Good. Last but not least, I'm going to test your deep tendon reflexes. Just try and relax as much as possible. Just relax your head. Is that hurting? Next, I'm going to be looking over your skin as well as your peripheral vascular system. Have you noticed any changes in your skin, like colors, lesions, spots,
No.
hair distribution? Just checking temperature, looking for any edema, checking your skin turgor. Looking at your nail beds, make sure there's no clubbing. Good cap refill. Good. I'm going to be looking at your head and face, looking at symmetry, contour. Let me know if there's any tenderness. Tenderness?
No.
Any changes in your hair or scalp?
No.
Just parting your hair so I can see. Good. Same thing on your face, just looking for symmetry. Your temporal arteries here. Good. Testing for TMJ and jaw strength up and down, side to side. Clench your jaw. Good. One more thing. Your sinuses. Any pressure here?
No.
Or here?
No.
Good. You just need to listen to your temporal arteries. Good. And we're also going to do the light touch on your face. If you could close your eyes, this is going to be the same thing.
Yep. No. 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 No.
Good. Next, I'm going to be looking at your eyes, looking for symmetry and looking at all the features, sclera, ducts, upper and lower lids. Can you look to the right, to the left, up, down? Just looking at all the features here. Any tenderness?
No.
Good. We're going to be testing your vision. Do you wear contacts or glasses?
No.
We're going to cover one eye and hold this about 14 inches away. Read the smallest line you can for me.
937826.
Very good. And the other eye.
428739.
Good. Next, I'm going to test your visual fields. I'm going to be wiggling my fingers. Tell me when they come into view.
Now. Now. Now.
Good. And follow my finger with your eyes, keeping your head still. Good. I'm going to dim the lights here and we're going to check your pupils. I'm looking for equal reaction to the light. Look straight forward. Good. Next, I'm going to be looking at the red reflex, your left eye with my left eye, and optic disc as well. Same thing on the right side. Alright, next I'm going to be looking at your ears, just looking for symmetry in their alignment. You're okay there. I'm going to be palpating here in your tragus. Let me know if there's any tenderness, your mastoid bone. Tenderness.
No.
Have you noticed any changes in your hearing?
No.
Okay, we're going to do what's called the whisper test. I'm going to cover one ear. I'm going to whisper numbers and letters, and you see if you can determine what they are.
9J4.
Good. And the other side.
3H9.
Good. Next is the Weber test. I'm going to make this vibrate, and you let me know if it sounds the same on in both ears. Same in both ears?
Yes.
Good. Next is the Renee test. It's going to be touching the behind your ear. When it stops, let me know. And then I'm going to move it to the front, and when it stops there, let me know.
Stop. Yep. So
Can you tell me when it stops?
stop.
When it stops in both spots.
Okay. Stop. Stop.
We're going to take a look inside your ears here. For any foreign objects, look at your ear canal, as well as your eardrum. Good. Next I'm going to be inspecting your nose. Outside features, can you tilt your head up? Look inside your nose here. Can you cover one side of your nose and sniff in? And the other side? Okay, close your eyes. I have a smelling object here. We'll see if you can identify the smell. Sniff in.
Alcohol.
Good, it's an alcohol swab. I'm going to put some gloves on here, and I'm going to be looking in your mouth. At all the structures, your teeth, gingiva, buccal mucosa, your palates, tongue. Okay, open. Lift your tongue up. Get on the top of your tongue. Alright, stick your tongue out and say ah. Good. Put your tongue from side to side. Good. Can you say tight, night, dynamite?
Tight night, dynamite.
Next, I'm going to be looking at your neck and your throat, just looking for contour, symmetry, looking at your tracheal position. And be feeling all of your nodes here. Let me know if there's any tenderness.
No. No.
Alright, good. And then feel your carotid arteries here. And carotid pulses. Let me listen to them as well. And looking for midline tracheal placement here. Good. And let me grab a cup of water. I'm going to check your thyroid when you swallow. Go ahead and take a sip and swallow. Good. Thank you. I'm also going to be testing your strength and cranial nerves. You can shrug your shoulders. Good. And push your neck into your head into my hand. Good. And then range of motion back and forth, side to side, and then tilt back and forth. Good. Next, I'm going to be doing musculoskeletal. If you could stand up for me and just stand by the table. I'm just looking for your symmetrical muscle distribution, your stature, posture. Good. And then I'm going to have you walk just regular down the straight line. Good. And back. And then heel to toe. Good. And back again. Okay, I'm going to have you stand right by the desk here and close your eyes with your arms resting. This is the Romberg test. If there's any extra swing, okay, good. And you can sit down. I'm just going to feel all of your relax for your joints for any tenderness, warmth, anything like that. Any tenderness?
No.
All right, we're going to go through range of motion exercises as well. After I take a look at your back, if you could turn around for me. Once again, count all your bony prominences. You could put your head forward. Just checking out your spine here. As well as your paravertebral muscles. Any tenderness?
No.
Alright, good. Turn towards me again. So with both arms, I just want you to follow what I do. So, arms out in front, up overhead, out to the side, up. You can do this one at a time. Out in front of your body, the other side, behind your shoulder blade, the other side, and then we're going to rotate up and down. Good. Now your elbows, we're going to flex and extend. Hold them 90 degrees and flip your hands over. Good. Now with your wrists, up and down, side to side. Good. And fingers in and out. Clench. Good. And squeeze my fingers. Good. Same with your legs, in and out. You can do both at the same time. Good. If you can rotate them, in and out. Good. Ankles, up and down, and inversion and eversion. Yep, and out. Good. Any tenderness through any of those?
No.
Okay. Now I'm going to start by looking at your chest and thorax. Again, on your backside. A couple different tests here. I'm going to count your ribs here from a different way. Alright, and I'm going to ask you to take a deep breath here. One more. Good. And I'm also going to check for something called CVA tenderness. You're going to feel me lightly pounding. Just let me know if it's tender at all.
No. No.
Good. Next is what's called tactile fremitus. I want you to repeat the phrase 99 for me.
99. 99. 99. 99.
Good. I'm going to listen to your lung sounds normally. Breathe in and out normal. Alright, now I'm going to ask you to repeat the phrase E over and over.
E. 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 E.
Good, and we're going to whisper 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. And last but not least, I need to percuss as well. And I'm going to ask you to take a deep breath in. Deep breath in and then hold it out. And hold. Alright, relax, catch your breath. And then a deep breath in and hold at the top. Good. Okay, you can turn around. We're going to do the same thing on the front, basically. I'm going to count your ribs here. Alright, the phrase 99.
99, 99, 99, 99.
Good. Alright, regular lung sounds, you can breathe normal. And then repeat the phrase E.
E, 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 E.
And we're going to whisper 1, 2, 3 again.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Good. And then while I still have you sitting, I'm going to be listening to your heart sounds. And just relax. Good. Okay, if you could take a seat on the bench. I'm going to first do you can lay back. Do an inspection. Okay. Thank you. Go ahead and try and relax your head. Be looking at your chest as well as your neck, looking for jugular vein distension, and make sure there's no visible heaves or pulsations. Good. If you could turn your head away and towards me. Good. I'm going to be palpating, make sure there's no heaves or thrills. As well as looking for the point of maximal impulse. And also listening in this position. Good. And if you could lay all the way down and towards your left side. Would you like a pillow?
No.
Okay, I'm also, if you could move this around, maybe listen to your heart sounds here as well. Okay, you can lay it on your back for me. the range of motion exercises, I also need to test your hips. So I'm going to be placing my arm underneath your back here. If you could lift your chin or your knee to your chest. Good. Keep it up there. We're going to rotate. Good. Just relax here. Any pain or tenderness?
No.
And then back. So the other side. Thank you. Knee to your chest. And rotate. In and out. Alright, relax here. We're gonna. Any pain or tenderness?
No.
Good. Okay. I'm gonna have you continue to lay down. I'm gonna look over your abdomen. Look at the contour, symmetry, visible masses. If you could lift your head for me, I'm gonna look for herniation. Good. I'm gonna listen to your belly first. Alright, I'm gonna be over your liver. I want you to take a deep breath. And same thing over your spleen. Good. I'm also going to listen to your the arteries in your belly. Is it renal, your iliac? I'm going to feel and listen to your femoral arteries as well. Alright, I'm going to press here. And gastric bubble. And then the span of your liver. As well as your spleen. Next I'm going to lightly palpate. Just let me know if there's any tenderness.
No.
Any bladder distension or tenderness?
No.
Good. Now I'm going to deeply palpate. Maybe a little uncomfortable. Any tenderness anywhere?
No.
Alright. I'm going to be feeling for your liver. I want you to take a deep breath in and out. Good. And the same thing for your spleen. Deep breath in and out. Good. If you could sit up for me. I need to check your pulses. So I'm checking your radial pulses here. Your brachial pulses. And the nodes in your elbow, which you normally cannot feel in a healthy patient. As well as your popliteal pulses and lymph nodes. As well as pulses in your feet. Just trying to think if there's anything I missed on you, Mr. Lombardo. And I don't believe there is. So this concludes our physical exam, and I appreciate you coming in this evening, and I just need to use my hand sanitizer before we part ways. And thank you very much.